Today I will discuss one unpaired cranial bone which forms the base of the skull, and it is sphenoid bone. It looks like the bat and it is having different parts. The main parts are the body and paired greater wing and paired lesser wing and two pterygoid process projecting downwards. I will discuss all the parts one by one. First of all, let us discuss the body. The central part is the body from which the lesser wing and greater wing they are extending sideways and the pterygoid process is projecting downwards. The shape of the body, it is cuboidal in shape and it is having 6 surfaces. This is superior surface or called cerebral surface. In the base of the skull, if I show you side by side, this is the superior surface. It forms the base of the skull, particularly the middle cranial fossa. Then inferior surface, which is opposite to the superior surface. This is inferior surface. Then anterior surface, this is anterior surface. This one. And this is posterior surface. Here also in this bone, this is posterior surface. So superior, inferior, anterior, posterior and 2 lateral surface. What are the features on the superior surface? I am showing you the features from anterior to posterior. This is anterior border with this one, a triangular projection called ethmoidal spine. Next to this flat surface is called jugum sphenoidale. It is smooth and flattened plate of bone and it lodges the olfactory tract and gyrus recti of the cerebral hemisphere. Then there is a ridge. Behind it there is a sulcus. This sulcus called the sulcus chiasmaticus which lodges optic chiasma. That means crossing of the optic nerve. Behind this prominent ridge is called tuberculum celli. It is an elevation just behind the sulcus chiasmaticus. Then there is a depression. This is called hypophyseal fossa, which lodges the hypophysis cerebri or pituitary gland. And behind this fossa, this is dorsum celli. And the dorsum celli, it is a quadrilateral plate of bone, and behind dorsum celli is the cleavus. So this is the cleavus which is formed by the sloping surface of the posterior part of the dorsum celli and the upper surface of the basilar part of this occipital bone. So this is cleavus. The tuberculum celli, hypophyseal fossa and dorsum celli together called sella turcica because it resembles the turkey saddle and it consists of these 3 parts. If you are asked, the hypophyseal fossa and sella turcica are both same in meaning, the answer is hypophyseal fossa is the deepest part of this sella turcica. The whole thing is sella turcica, but its deepest part is the hypophyseal fossa. And the content of hypophyseal fossa, number 1, that is pituitary gland and meningeal and endosteal layer of dura mater and anterior and posterior intercavernous sinus, because here you will get the cavernous sinus on both sides. They are connected by anterior and posterior intercavernous sinus. And deep to this hypophyseal fossa, there is a air sinus called sphenoidal air sinus. And another important anatomical feature, this small process, small bony projection on each side of the tuberculum celli is called middle clinoid process. You see in this base of the skull, this is tuberculum celli. So this is middle clinoid process of this side. This is middle clinoid process. So how many clinoid process you will get? You know this is middle clinoid process here. and this is anterior clinoid process. Anterior clinoid process means it is the medial end of the posterior border of lesser wing of sphenoid, and posterior clinoid process is here. It is the superior angle of the dorsum celli on other side bears the posterior clinoid process, and these clinoid process they are interconnected or interrelated. The middle clinoid process, it is connected with the anterior clinoid process on both sides by a ligament called carotidoclinoid ligament, and this carotidoclinoid ligament and the body of the sphenoid, it forms a canal. This canal called carotidoclinoid foramen, and this foramen transmits the internal carotid artery in this way. This is the ligament, and the posterior clinoid process, it is connected with the anterior clinoid process by a ligament in this way. It is called interclinoid ligament. And another term is there called petrosal process. It is a small projection from the lateral margin of the dorsum celli. This petrosal process, it articulates with the apex of petrous part of temporal bone. Here you see, this is the petrous part of temporal bone, and it articulates with this petrosal process here, the lateral margin of dorsum celli. So this petrosal process to the apex of the petrous part of temporal bone. This is called petrosphenoid ligament, and the structure passing deep to this petrosphenoid ligament, here you see, is the abducent nerve or sixth cranial nerve. On the lateral surface, at the junction with the greater ring of sphenoid, there is a sulcus. This sulcus on each side called carotid sulcus. This sulcus contains internal carotid artery surrounded by the plexus of sympathetic nerve and cavernous sinus. Lateral to the sulcus, at its posterior part, here there is a bony projection on each side. This is called lingula, and here is a groove. This groove lodges the internal carotid artery and cavernous sinus. So it supports the structure in the carotid sulcus. And another structure is there over this hypophyseal fossa, that is called diaphragma celli. This is dorsum celli. This is diaphragma celli. Diaphragma celli, it is a fold of dura mater, and it forms the roof of this hypophyseal fossa. Then come to the anterior surface. This is anterior surface and this is inferior surface. In the anterior surface, you will get in the midline a crest, the sphenoidal crest, which articulates with the perpendicular plate of ethmoid bone, making a small contribution to the nasal septum. On each side of this crest, there is a thin plate of bone, and this thin plate of bone is called the sphenoidal concha. Sphenoidal concha having upper part and lower part. Here is the lower part in the inferior surface, and in the upper part is on the anterior surface. This sphenoidal concha, it closes the, or it forms the floor of this sphenoidal air sinus. Here you will get the sphenoidal concha. So if I rotate it, so it forms the floor of the sphenoidal air sinus, which is inside it. This is sphenoidal air sinus within the body, leaving a small opening through which the sinus opens into the superior meatus of the nose. And another structure is this depressed area. It is a rough and depressed area above and lateral to this, the opening for the sphenoidal air sinus. This area, it is articular area and articulates with the posterior aspect of labyrinth of ethmoid bone and completes the posterior ethmoidal air sinus. Then come to the inferior surface. This is inferior surface. In the inferior surface, again you will get three important anatomical features. One is sphenoidal rostrum, and it is a midline structure, and this rostrum, it is nothing but the continuation of the sphenoidal crest from the anterior surface, then to the inferior surface, it forms the sphenoidal rostrum, and this rostrum, It is a median ridge which articulates with the grooved upper margin of the vomer between its diverging ala. Here the rostrum articulates here. This is the ala of the vomer. Can you see the diverging ala? And here you will get the concha. Another feature is the vaginal process. From both sides, a process, triangular process, self-like process, projecting medially from the base of the medial pterygoid plate. This is medial pterygoid plate, and this vaginal process and the vomer here form a canal called the vomerovaginal canal. Usually, this canal does not transmit any structure. Then come to the posterior surface here. This surface, it articulates with the anterior surface of the basilar part of the occipital bone. This is occipital bone. This is the basilar part. It articulates with the posterior surface of the body of sphenoid, forming the basi-occiput or basi-sphenoid, and it is a primary cartilaginous joint, and usually it fuses or becomes synostosis at the age of 25 years.